Hi everyone, Dr. Tushar here. I'm a medical oncologist, which means I specialize in treating cancer using medication. I'm passionate about raising awareness and providing education regarding cancer. Today, we're going to talk about cancer treatment and what to expect along the way. Remember, knowledge is power. The more understanding you have about your cancer treatment, you can take better decisions. So let's get started. Cancer treatment is a two-part process, planning and its effect. Let's break it down. Let's talk about planning first. Did you know that there are over 100 different types of cancers? Each cancer treatment requires a different treatment plan. So, one size does not fit all. Each patient is unique, and that's where personalized cancer treatment comes into play. By tailoring treatment to your needs, we can increase the chance of success. Planning is a three-step punch to cancer. It involves treatment options, that is, picking the right weapon to fight against cancer. And finally, once you have selected your weapon, the sequencing. It's the order we use the weapons for increasing the impact to cancer. It's very important for best outcomes. And finally, modification. After the initial plan, finer adjustments may be needed based on your fitness level and tolerance to treatment. Let's talk about options first. A well thought of treatment plan typically includes a combination of surgery, radiation, and systemic therapy. Why are so many treatments necessary? Because cancer is a tricky little disease. It's the evil geniuses of all diseases. It's always changing, always adapting. And it's not just one disease, it's a whole family of diseases. Let me explain this with an analogy. Let's say you want to buy some apples. There are different varieties of apples. Some are sweet and juicy, others are tart and crispy. How do you choose which apple to use? It's based on what you want to make. If you want to make applesauce, salad, or do you want to use it for baking? Just like with apples, there are a lot of different treatment options in oncology. In systemic therapy, we've got chemo, immunotherapy, targeted therapy, IPEC, original molecule or a generic molecule. Surgery too, we've got plenty of options. Radiation too, we've got many. Having too many options, it's very confusing. So, you as a patient, how do you choose which treatment you need? Of course, you're going to depend on your oncologist. They'll guide you in the right way. How does your oncologist figure out what is best for you? It's a balancing act. The benefit of treatment versus the harm of treatment. In most cases, the benefit usually outweigh the harm. There are different types and stages of cancer, and each one requires a tailored treatment approach, such as advanced stage breast cancer. We may need only surgery, chemo, and radiation, three treatment, while an early stage prostate cancer may need only surgery alone, a single treatment, and an advanced lymphoma may need chemo and radiation, two treatments. So you see here, some patients are getting three treatments, some patients are getting one, the others are only getting two treatments. Why is this necessary? To get the best benefit, reduce the cost, and know about the expected side effects of treatment. Let's say you have a lymphoma and you give chemo, radiation, and you do surgery. What happens is you're over treating the patient. So, unnecessary side effects of chemo and radiation increased cost to the patient. In the past, treatment options were like this. They were based on the fact that you had cancer and not the type and stage. That is, we used to follow a one size fit all approach. And this was because our understanding of cancer was limited then. But in the present, cancer is no longer a one size fits all disease. We are following tailored treatment approach. That is, not every cancer needs the full treatment. The benefit of tailoring is maximizing the benefit, improving the quality of life, minimizing the side effects, and reducing the cost. When planning, the questions to ask are where is it, what stage is it, and what type is it. In my last video, I've talked about stage and type is. If you haven't watched, please do. But let me explain these terms a little better because it is important to understand the treatment of cancer. Let's say a patient has breast cancer, stage 3 and triple negative. So what treatments would they need? They would need systemic therapy, surgery and radiation. By simply changing the stage and the type, the treatment can be completely different. In this case, a stage 1 breast cancer with hormone positive type would need only surgery and endocrine therapy. So how does your oncologist know all this? We read a lot of journals. What are journals? They're the cheat codes in fighting cancer. They give us a lot of knowledge. And from this knowledge, we know what the latest advancements are. Giving you the latest treatment, there is an increased chance of victory over cancer. Here are some highly respected journals. Planning. There are three basic questions you should ask before we start planning. They are where is it, what stage is it, and what type is it. In my last video, I talked about the importance of staging the type of cancer. So if you didn't watch it, please do. But to understand treatment of cancer, you should have a basic idea about these. So let me explain. Let's say you've got breast cancer, stage 3 and triple negative type. So you would need all three treatments like systemic therapy, surgery and radiation. By simply changing the stage and the type, treatments can be completely different. Here, stage 1 and hormone positive may only need surgery and endocrine therapy. So how does your oncologist know all this? Well, we read a lot of journals. And what are journals? They're the cheat codes to fighting cancer. Basically, they give us a lot of knowledge. And from this knowledge comes the latest advances. And by knowing the latest advances, we can increase the chance of victory against cancer. Some examples of journals are, we've got JAMA, Nature, and the New England Journal of Medicine. There are hundreds of journals published every year. It's very hard to keep track of all the journals. That is where guidelines come. Guidelines are like the battle plans created by cancer experts. They give you the best shot of winning. What do? They level the playing field so that no matter where you are, you get the standard treatment. And guidelines are based on latest research. So your chance of victory increases by following them, and they're tailor made for you. For example, for adults, they consider your age, your health, and the type of cancer. And for kids, they take into account the growing body type to minimize the long term effects of cancer. So, journals give you knowledge, and guidelines translate this knowledge into action to fight against cancer. If we don't follow guidelines, some patients may get too much treatment and some patients may get less treatment. So, following guidelines is important. They are the rule of the road while taking cancer treatment, and they're constantly evolving. They aren't set in stone. As new discoveries are made, they are updated to reflect the latest science. Examples of guidelines: the American guidelines are called NCCN, and the European guidelines are called ESMO. These are for adults. For children, the American guidelines are called ASHFO and the European guidelines are called CIO. Let me help you understand guidelines with the example of our basic questions. I usually follow the European guideline. Here, the first question is, where is it? It's breast cancer, and what stage is it? Early stage breast cancer. Coming to the third question, the type. We've got various types like hormone positive, HER2 positive, and triple negative breast cancer. Here, if you see, some patients, based on the type and stage, are getting chemo first, while others are getting chemo later. Also, some patients are getting surgery first, while some are getting surgery later. Why is this? This is where the importance of sequencing comes in. Sequencing is basically following a recipe. For example, let's say you're making a cake. You start with the flour, sugar, and butter. That's your foundation. Then you add in the egg, milk, and vanilla. That's the flavor. And finally, you add the frosting. That's the finishing touch. You wouldn't put the frosting first. It would make cake a mess. And also, there comes the importance of timing. You cook the cake for too long, it's going to be burnt. And if you cook the cake for less time, it's going to be undercooked. So you leave it to the professionals. Cancer treatment is a lot more complicated than baking a cake, but the rules apply the same. Consider the sequence A, B, C, D and let each represent a treatment. Let's say the sum of all these treatments is 10. In reality, slightly changing the sequencing, giving chemo first or giving radiation first, would also result in the same, but that is not true in oncology. In reality, let's say A plus B is equal to 2. In oncology, A plus B can be 1, A plus B can be minus 1, and changing the sequence B followed by A can give you better results, say 5 years. So when you follow the standard sequencing A, B, C, D, let's say you get a result called 10. Slightly changing the sequencing, we can get double the result. So you get the best results possible. And wrongly sequencing it can be bad for you. That is the importance of sequencing. So what is sequencing based on? It is based on two things: patient and tumor factors. Let me explain. By knowing the type and stage, we can sequence. Here, you see there are three types and each one has their own stage, and based on which each type and stage has got their own sequencing. To understand it better, let's focus on triple negative breast cancer. As I said before, stage 3 triple negative breast cancer will need all three treatments. But what is the right order of sequencing? Here it is systemic therapy followed by surgery and then radiation. Now that we understood the importance of planning, let's talk about the effect of treatment. As I said before, your oncologist is going to help you choose the best option by balancing harm versus benefit. Let's focus on benefit. The term used is quantity of life. Quantity of life after cancer diagnosis is nothing but how long you will live. The other way you can ask the same question is, am I free of cancer? Unfortunately, in oncology, there isn't a straightforward answer for this. It's a time bound answer. Let me explain further. To answer the question, am I free of tumor? You have to achieve two milestones. The first one is in the present, that is achieving a complete control of your tumor, also called cancer free state. The second milestone is in the future. It is a 5-year mark. Only after achieving these two milestones can you say you are cured of cancer. Achieving a complete control is a major victory. Essentially, it has got two benefits. One, you tend to live longer, and the second, the chance of it coming back is also lesser. The third hidden benefit is sometimes you can even reduce the treatment if you can achieve a complete control early on in your treatment. After achieving complete control, the next milestone is the 5-year mark. It's a time based benchmark. It's an important checkpoint in your fight against cancer. The longer you go without your cancer coming back, the better is your chance of staying cancer free. Here's the key thing, it's a cause of celebration, but it's not the finish line. Why? Because it's not a guarantee of cure. There's still a small chance the cancer could recur later in life. What can go wrong during cancer treatment? I always tell my patients, battlefield of oncology is a complex one. It's not straightforward. Success matters here, but that is not always the case. So what can go wrong? If you don't achieve the first milestone, that is you don't have a complete control, can also call it as incomplete control, it suggests an adverse outcome. Remember, that is not the end of the fight. An incomplete response can suggest that we may have to increase the intensity of treatment. If you have initial success with treatment, then we can focus on the future management of cancer and its two evils, which usually happen within the first 5 years. One is recurrence. This is the relentless foe. Imagine an enemy who retreats after a fight only to launch a surprise attack later. Recurrence in oncology includes this very notion. The second evil is progression. It's the evolving enemy. Cancer adapts, evolves over time, and comes back resistant to future treatments. Both of these can happen even after achieving your first milestone, that is complete control, and they indicate a more aggressive form of the disease. Cancer treatment is not successful if either cancer is not controlled initially or has recurred or progressed in the future. These phrases can send shivers down the spine of anyone who's been through cancer treatment. It can be scary and an overwhelming experience, but it is important to remember that it is not the end of things. There are many people who have fought cancer recurrence and progression and gone on to live long. So, what do you do when any of these things happen? Of course, we should stop cancer from growing. To stop any cancer, we have to take treatment. So, what is the goal of treatment? And this is nothing but to stop cancer growth, not to completely control it or cure it. This is called palliation, meaning fighting cancer like a boss but with more comfort. It's like a strategic attack aiming to weaken the enemy, not to take them down completely. That is, not throwing everything you have at the cancer to destroy it, instead, to make sure you feel as good as possible while you fight it. In palliation, we have got various treatment options, again, like chemo, surgery, radiation. So, the goal of any cancer treatment is either get a complete control, then to cure, and then finally palliation. So, what determines what is the goal of treatment? It is a stage. Stage 1 cancer is like a seedling. It is small, contain high chance of cure with proper treatment. But if you don't take care of it, it can grow. Stage 2 cancer is like a sapling or a plant. It's starting to grow and spread, but it's still relatively small. With treatment, you can still have a good chance of cure. Stage 3 cancer is like a tree. It has grown large and strong and begun to spread. Treatment options are more challenging but still possible. Stage 4 cancer is like a forest. It has spread throughout your body. But even at this stage, there is treatment to help you live a long and full life. Let's talk about early stage cancer, stage 1 and stage 2. Here, complete control is always possible. There's a high chance of cure and there's no role for palliation. Let's talk about stage 3 now. Stage 3 represents a tree. So it has got branches, a trunk, and a root. The branches represent the tumor burden and the roots, the source of cancer cells. So when you want to treat stage 3, you have to remove the branches, the trunk, and the roots. There are types in stage 3. The normal one is with the normal branches and roots. The other types are like a bonsai tree, which has got smaller branches and smaller roots, and a massive tree with massive branches and massive root system. In most of the stage 3, complete control is possible, cure too is possible, and hence there is no or minimal role for palliation. In some stage 3, extensive branches and roots, despite removing the branches and roots, some roots can remain, and these can lead to a recurrence. That is, the cancer can grow back from the stem cells. So, partial control is possible. There is a less chance of cure, and you may end up needing palliation. Stage 4 represents a forest. In oncology, even a handful of trees, 4 to 5 in number, is also considered a forest, and it has a special name. It is called oligometastatic. In most stage 4, complete control is not possible, cure is not possible. Most of the time, you will need palliation. In some stage 4, like oligometastatic, if you can achieve a complete control, cure too is possible, and you may not need palliation. In some stage 4, where partial control is only achieved, that means your tumor is not completely controlled, you will not be cured and you will end up needing palliation. So since the last few slides I've been talking about palliation a lot, let's dwell deeper into it. When do we palliate? Stage 1 to 4 cancer where control is not possible or has recurred or progressed. So palliative treatment focuses on patient's quality, not quantity of life. Palliative treatment can shrink tumors, reduce pain or pressure symptoms, and address other symptoms too. So let's say before starting treatment, you've got 100% cancer. After taking treatment, usually the expected thing is it should reduce in size. But in palliation, responses can range from 100 to 0%. So there are some patients who've got a stable disease, some patients who have partially responded, and some patients who've got a complete response. Even 100% disease at the end of treatment one is considered fine in palliation because the goal is to stop cancer growth. That is very important. So after treatment, again the cancer increases in size. So when you assess what has happened, you've had a response, and at some point the cancer has become resistant, has increased in size. So now what do you do? Do we give up? Of course not. You go for the second line treatment. It's like that old saying, if at first you don't succeed, try again and again and again. You go for the second treatment. Now what happens? Again, the tumor shrinks. Again, it increases in size. So if you are observed, before treatment one, you had 100% cancer. At the time of treatment two, you've got 150% cancer. And before starting treatment three, you've got 200% cancer. So your cancer keeps increasing in size before each treatment. Definitely, it does respond in between. What does your doctor do again? We advise you the third line treatment. Again, the tumor reduces, and again, it increases. In summary, each time you take treatment, you respond and eventually it becomes resistant. This is the relentless dance of cancer. Let's summarize what we understood so far. You've taken one treatment, gone to the next and next, and say you have reached the fourth line of treatment. Between each treatment, there is a gap. This is called treatment free interval. It's the time from last treatment to the start of the subsequent treatment. During this period, your cancer is under control, which is great news. But even though you're feeling healthy, cancer showing good results, you still have to go to your doctor every few months for checkups. But you're not totally free. You know it's gonna come back. So it's like always you're looking over your shoulder. So it's best to make the most use of these treatment-free intervals. If you have any wishes or if you want to do something in life, go ahead. As you go through various lines of treatment, the treatment breaks keep reducing. Here, after the first treatment, you get about 1 year before the second line. After the second line, you get about 6 months before the third line. That is, as you have observed, breaks between each treatment keeps reducing. Some patients, it may be definitely longer, depending on the situation and the advances in treatment. The treatment response wanes as you go from first line to later lines of treatment. Why is this? Because cancer cells are adapting, they're becoming resistant to your treatment. Cancer resistance is a major hurdle in cancer treatment. It has two phases. The first phase happens during the first few treatment lines. So you have response and resistance that is happening there. In the second type of resistance, whatever treatment you take, your cancer is going to become resistant. So there is no point taking treatment after a few lines of treatment. And as you progress through various lines of treatment, your fitness keeps reducing. Now, it is easy to blame your treatment because you are going through various treatments, but it's actually not the treatment. And as I've told you before each treatment, your cancer burden increases. This is what is causing your fitness to drop. Finally, at one point, your cancer is going to become resistant to all forms of treatment. What do? This is where palliative care comes into play. You do this when your cancer has become resistant and your fitness has also dropped. During this period, the main goals are pain management, symptom controls, like if you have nausea and shortness of breath, addressing them, and emotional support. Palliative care doesn't mean giving up, it's more like fighting smart. And finally, at one point, it's the final stage of your life. My advice is during this time, talk to your doctor about DNA and DNR. I don't want to go into the details about what they are, but it's a crucial thing to talk to your doctor about. Now, while the benefits of treatment planning are undeniable, it's crucial to acknowledge the harms of treatment. That is, the side effects. Side effects are uninvited guests at a party. Side effects are classified based on probability, timing, and the type of treatment. Understanding them is important so that it can improve your communication with your oncologist. There are some preventive measures that can be taken, and you can effectively manage them when they do occur. Also, knowing about them will reduce your anxiety. So let's talk about treatment and side effects first. In oncology, as I've said before, you've got various treatment options. Each of them can cause different side effects. It's important to remember that side effects can be anything from mild to severe. They can range from nausea and vomiting to liver damage and even end of life of a person. So it's important to know your side effects. Surgery and chemotherapy and potentially even radiotherapy can be very effective. However, these treatments can also interact with each other, leading to increase or intensified side effects. Example, infection, wound healing, nausea and vomiting. Now coming to the probability of side effects. It's like the game of Russian roulette, but with your health as the target. The probability of side effects vary greatly, but essentially with almost any cancer treatment you will face some side effects. So some side effects is a 100% chance you'll experience them. These might be nausea, fatigue, and which can be effectively managed. There is a chance of more serious side effects like heart failure, liver damage, which can occur in 10% or less. Based on probability, we can classify side effects as very common, common, and rare. It is important to remember that side effects can be anything from mild to severe, like vomiting can be mild, moderate, or severe vomiting. Why know the probability? For common side effects, preventive action during treatment can be taken, and for rare side effects, during follow up, early detection and early intervention can be done. Everything in life has a time and place, even side effects too. Some side effects are like, I'm just passing through and they disappear after you're done with them. But some side effects are persistent ones that stick around for days to weeks, like a bad roommate who won't pay rent. And then there are the sneaky ones that take their own sweet time. They usually come up months to years after treatment. So now that we understood planning and its effects, how do we accept a plan? Let's go back to our example. Breast cancer, stage 1 to 3, triple negative. Standard treatment is systemic therapy followed by surgery and radiation. Now, this is a plan and we call it Plan 1A. So, how does your oncologist accept this plan? They weigh the potential benefits against the harms before committing to a plan. Let me elaborate. In an ideal scenario, the benefits outweigh the side effects, and this we can easily go with this. And this is the case in stage 1 and 2 cancers. Once we go to advanced cancers, the benefit reduces and the side effects are still acceptable. So we still go with this plan. And this is the case with stage 3 cancers. When you're palliating and you go with the standard treatment, the benefit greatly reduces and the side effects increase. So what does your oncologist do? He will not accept the plan 1 and he will slightly modify the treatment in such a way that you've got better outcomes and acceptable side effects. And this is plan 2, which is a modification of plan 1. So what exactly happened here? If we go with the standard treatment like curative setting, we get inferior results in palliation. So, in palliation, remember it's all about comfort while fighting cancer. By reducing treatment, we can get better outcomes actually. And in most cases, even a single treatment may be sufficient to give us appropriate results. Now, let's talk about blood cancers. There are two types, slow growing and the fast growing. Just like in early stage solid cancers, you accept a plan when you get more benefit and less side effects. And this is the case with slow growing tumors. But in fast growing tumors, it's exactly the opposite. More the treatment you take, the more the benefit you have, and more the side effects you have to face. So based on this, you've got various plans 1, 2, and 3. How do you decide on a plan? Based on your fitness level. Why to balance benefit versus harm in oncology? It is to modify treatment based on your fitness level. Getting more treatment if you're weak will only harm you rather than benefit you. This modification of treatment based on your fitness level is called quality of life. Battling cancer is like facing a tough opponent. You have to be in good shape and fight back. That's fitness. But you've got to enjoy your fight also. That's quality of life. So the question is, will I tolerate treatment? To understand this, we must understand the human body. Human body is a composition of organs. These organs work together in a way to keep us alive and functioning. This is just like gears in a machine. For understanding better, let's assume each organ has a gear. From birth, the organs start working together, and as you age, they start wearing down and finally break down. A fit patient is someone whose organs are functioning well, has no limitations physically or mentally. This allows them to tolerate more aggressive treatment, curative surgeries, and combination therapy, including full dose chemo, targeted therapies, and immunotherapy too. So we can maximize cancer control here. An elderly patient may have pre-existing health conditions or they may have physical and mental limitations. This doesn't mean treatment is off the table. Some modifications are needed. We can estimate their fitness based on the following: underlying health conditions, the functional status, and cognitive function, based on which we can understand if they can tolerate treatment or not. Just to give you an understanding about elderly patients, Some are bedridden and may not tolerate treatment. Some are frail and need treatment modifications. And some are fit and can tolerate the standard treatment. So elderly are very dynamic. Based on their fitness, we have to balance treatment intensity versus functionality, plan for minimal invasive surgeries, avoid combination therapies, and we may need dose modification of chemotherapy, targeted therapy, and immunotherapy. To understand this better, let's give one point to each treatment for the side effects they can cause. Now the total here is 4. This 4 is a stress on the body. The question is, can the elderly patient tolerate or not? The fit elderly can tolerate, but the frail and the bedridden may not tolerate this treatment. Now, since they are unable to, let's de-escalate the treatment a bit. Now the sum comes to 3 after removing chemotherapy. Can the elderly tolerate this treatment? The frail can, but the bedridden may not. Let's further de-escalate the treatment. Can they now tolerate the treatment? Well, the frail, the bedridden patients may or may not. So how do we know in oncology whether patient can tolerate treatment or not? I generally use a calculator called Cancer and Aging Research Group Chemotherapy Toxicity Tool. It's a questionnaire used by doctors to estimate the risk of severe side effects in elderly patients. How does it work? By answering the above questions, it generates a score. This score indicates the patient's risk of experiencing severe side effects from chemotherapy. The benefit is it allows for more personalized approach to cancer. De-escalation or escalation can be done based on this. The next question is, should I take treatment? Remember, cancer is just a disease. It's not a death sentence. It's something that you can beat. You have two choices: take treatment and have a chance of surviving, or you can let nature take its course. The decision to treat is personal. I would recommend you to take treatment at all stages 1, 2, 3, and 4. What about when the goal is palliation? Here, the decision to treat is very personal and a complex one. There's no single right answer. Many oncologists will not recommend active cancer treatment when they recognize that their patients are in the last few months of life. This may be 3 to 6 months. Now I know what you're thinking. That's crazy. Why would your oncologist do this? You should do everything you can to fight this thing. I understand that. But here's the thing. You've been fighting for your whole life and finally your body is tired of fighting. So why do you want to spend the rest of your life in a hospital hooked up to machines? I'm sure you'd rather spend time with people you love at your home. The next question is cost of treatment. Cancer is not a cheap disease. It's like the mafia of diseases. It'll take everything you have and then it'll ask for more. One of the first things that many patients ask me after diagnosis of cancer is, how much is the treatment going to cost me? Remember, more the treatment, more the cost. And you should also be aware of hidden costs. What are these hidden costs? They're procedure and anesthesia charges, potential complications requiring additional interventions, and ICU charges. What can we do about it? To take cancer treatment, you need a financial battle plan. You can pay from your pocket, of course, and many people do it, but this can be financially crippling. It's not uncommon to go into debts or even bankruptcy to cover the cost of your treatment. The other option is going for a health insurance. Most health insurances cover at least a portion of the cancer treatment cost. So it's important to know what your insurance covers and doesn't cover. Crowdfunding platforms like Milap and Keto can be useful for patients seeking financial support. The Indian government too does its part. They provide financial aid to patients through national schemes like Rashtriya Arogya Nidhi, the state level schemes like Arogyasri and Yashaswini scheme. Don't be afraid to discuss cost with your doctor and see if there are any alternative options that can be useful. Some pharmaceutical companies offer drug assistance programs to help you cover the cost of medication. And hospitals too do their part. They have dedicated financial aid departments that will help patients struggling with treatment costs. So don't hesitate to reach out to your hospital administration. Congratulations for bearing with me to the end of this video. Now that we have covered the basics of cancer, what happens before diagnosis, after diagnosis, and finally treatment today, let the fight against cancer begin. From my next video onwards, I'll be talking about each specific cancer type. So if you want to be well informed about what the treatment is, and you like, share, and subscribe. Thank you.